hello. A question I get asked all the time is, what is the difference between a therapist, social worker, psychologist, and psychiatrist? I'm in the profession and it's still confusing to me at times. There's a lot of overlap. So I decided to make this video and give examples of how I think we are different, but also how we can work together. Hopefully, this will help you determine what your needs are and who might be best suited to help you. So let's get started. What does a psychotherapist do? If we're thinking about a school counselor in a school setting, that school counselor may come across a 9-year-old who's having some behavior problems, and the behavior problems are starting to impact the schoolwork. So that school counselor might reach out to the parents and recommend or refer them to a psychotherapist so they can get mental health services for their daughter. The parents meet with the psychotherapist and discuss their concerns. After speaking, the psychotherapist may determine that the 9-year-old is struggling with some anxiety. That psychotherapist works with the parents to create a collaborative plan which will decrease the behaviors being seen at school and help them to tolerate the anxiety that is present. During the discussion, the psychotherapist may also find out from the parents that they've recently been involved in a house fire, so they are currently homeless and really struggling. The psychotherapist refers them to a social worker for additional support. What does a social worker do? A social worker meets with parents of a family who recently experienced a house fire. She sets them up with federal assistance for housing options and learns that there's a 9-year-old child who is struggling but also receiving psychotherapy services. The social worker finds after-school clubs with free transportation for the 9-year-old to participate in. Meanwhile, she helps the parents locate a support group that can help them with the aftermath of the house fire. What does a psychologist do? A school psychologist is setting up an anxiety support group for kids at school. Because the parents allowed the psychotherapist and school counselor to communicate, the school psychologist is aware that a 9-year-old girl would be a perfect fit for this group. The school psychologist reaches out to the parents to explain the group and meets with the child. What does a psychiatrist do? A psychiatrist meets with a parent who was in a house fire about a month ago. The parent reports trouble sleeping and difficulty at work, so much so that it's starting to negatively impact his work. The parent also mentions that he's already receiving help with psychotherapy and help from a social worker. The psychiatrist determines the best fit for him would be medication. The psychiatrist goes over medication, education, and what to look for side effects. Then they set up an appointment for next month. I hope these examples have helped you see the differences between these helping professions, but also how they can collaboratively work together to meet your needs. Really, the question is, what are your needs? What do you want support with? It's important to have a collaborative relationship with whatever provider you choose. Otherwise, it's not going to be effective or work. In follow-up videos, I'll be talking about how to find a provider and what kind of questions to ask. Thank you for listening. Don't forget to hit the subscribe button if you found this to be helpful, or drop some comments below. Loud truck, yep, and thunder.